Hello, my name is April Jones, and today we'll be discussing voice disorders. Some terms associated with voice disorders are vocal nodules, vocal polyps, vocal fold paralysis, paradoxical vocal fold movement, and spasmodic dysphonia. A voice disorder is defined as the abnormal production and/or absences of vocal quality, pitch, loudness, resonance, and/or duration, which is inappropriate for an individual's age or sex. Over a normal human lifespan, we will all experience voice changes. There are a variety of voice disorders caused by inflammation or edema and lesions such as the nodules and the polyps. As human beings, we will all have problems with our voices that can range from colds, allergies, bronchitis, exposure to irritants, or screaming for your favorite singer. Now, a vocal cord nodule is defined as a benign growth on both vocal cords that are caused by vocal abuse. A polyp can take a number of forms. Sometimes they're caused by vocal abuse, and they can be on one or both of the vocal folds. Vocal cord paralysis is when one or both of the vocal folds are unable to move. The person will experience voice problems and possibly breathing and swallowing problems as well. Paradoxical vocal fold movement is a disorder in which the vocal folds behave in a normal fashion almost all the time, but when an episode occurs, the vocal folds will close when they should open, such as when breathing. And spasmodic dysphonia is a chronic long-term voice disorder in which the vocal folds spasm when trying to speak, resulting in a jerky, quivery, hoarse, tight, or strained voice. This afternoon, I will have a special client, Keonce Bowles. She is a 22-year-old African-American female who has been referred to this clinic by her otolaryngologist, Merrill Heights, MD, with a diagnosis of vocal fold nodules. Per her medical report, she has no previous history of speech and language difficulties. You may come in now, Miss Bowles. Good morning.
Good morning.
How are you doing?
I'm wonderful. How are you?
I'm very well. May I call you Miss Bowles?
Keonce.
Okay, Keonce. I see here in your case history that you referred to us by your otolaryngologist for vocal fold nodules. Is that correct? Okay. Can you tell me when you noticed this, when it started, how did it come about?
I was singing on tour and I just had this lump in my throat. And I don't know. I don't know. It hurts.
It hurts. So pain is definitely a symptom.
Mm-hmm.
Have you had any other issues with your voice before?
No. I'm a singer, so I have to.
So you use it all the time?
I have to, yeah.
Okay. Well, I'm going to ask you a few questions, okay, regarding your voice. So you just answer, however you feel. Well, I know how you use your voice on a daily basis, and I know that your occupation is a singer, but would you say that you are yelling often or taking your voice to an extreme level?
No. I think I'm pretty moderate, except when I'm singing, because I'm a singer.
Okay. Do you clear your throat often?
No, that's not good for your throat. My vocal teacher told me that's not.
That's absolutely correct.
No.
Are you currently taking any medications, or do you have acid reflux issues?
Acid reflux, no. Medications, I care not to share.
Okay. Okay. Do you smoke?
No.
Okay. Do you drink water?
Absolutely.
Do you drink a lot of water?
Absolutely.
Okay, great. And how much sleep would you say that you get each night?
When I'm off tour, I sleep pretty well. When I'm on tour, not so much, but right now I'm not on tour, so
okay.
I'm getting pretty good.
So you're getting a good amount of sleep. Okay, well, the questions that I just asked you are all forms of vocal abuse or So we're going to start with a laryngeal vocal cord exercise. And this exercise should be completed very slowly and with attention to your voice quality, okay? And at the lowest volume that you can sustain. And I have some water here in case you need to take a few sips while we're doing this. Now this is called the yawn sigh technique. You're going to yawn as authentically as possible and lift your chin and feel your throat as it goes down as you yawn. And then breathe in deeply And as you exhale, you're going to sigh a very soft, mild, cottony type of sigh. And you're going to hold that for about 3 to 5 seconds. And I'm going to demonstrate, and then you can model what I have just demonstrated. Okay? So, okay? All right, your turn to try. Okay, you're going to have to open that mouth up for a very wide yawn. Okay, we're getting better, we're getting there. So this time, let's try to just bring your chin up. Make the yawn sound kind of more natural and the sigh a little softer. Okay, that's much better, but maybe an even softer sigh. Kind of maybe even barely audible. That's perfect. And you hold that sigh for 3 to 5 seconds, and you're going to repeat that exercise about 10 times. Okay? Big yawn. Big yawn. Soft sigh. Great. All right, Kiance, that's going to be all for our session today. I'm going to leave you with the information about the surgery as well as a vocal hygiene checklist, okay, so that you can keep up with your vocal hygiene exercises. And don't forget the yawn sigh technique, okay, because it will help to reduce the tension in your larynx. And it has really been a pleasure. Thank you. Today I will be seeing my client, Kiance Bowles, again for her vocal fold nodule treatment. You may come in, Miss Bowles. How are you today?
I'm wonderful. How are you?
I'm good. So it's been about 3 weeks. So how has the voice therapy and the vocal hygiene, how has it helped you?
It's helpful, definitely. However, I just don't think these techniques are going to work for me. I'm getting ready to go on a worldwide tour, and I really need this to be sped up, you know. So, is there anything I can do to make this go away?
There is another option. It is vocal cord surgery to remove the nodules, and you can speak with your primary care physician, and he will be able to recommend you to a good surgeon. And the surgeon will be able to explain everything to you about the pre-op and the post-op. But I would like to just inform you that it's not a very quick turnaround with this. It's going to be at least a few weeks recovery time, okay?
That's fine. Just whatever to get it away.
Okay. So we can give you this, and also I'm going to give you this vocal hygiene exercise worksheet just so you can keep up with your vocal hygiene because you don't want those nodules to return. All right, Kiance, that's going to be all for our session today. I'm going to leave you with the information about the surgery as well as a vocal hygiene checklist, okay, so that you can keep up with your vocal hygiene exercises. And don't forget the yawn sigh technique, okay, because it will help to reduce the tension in your larynx. And it has really been a pleasure. Thank you. Hello, my name is April Jones, SLP, and today I will be seeing a client whom I saw about 3 weeks ago. Her name is Kiance Bowles. She's a 20-year-old African-American star, famous singer, and she had come to me with a concern of vocal fold nodules. So now she's here for her follow-up visit. You may come in, Ms. Bowles. Hello. Hi, how are you doing today? It's good to see you again. So, the last time I saw you had a concern about your vocal nodules. Do you still have the nodules, or
I do still have the nodules, so that's why I'm here today. I wanted to schedule another appointment.
So you didn't go through with the surgery?
No, I'm trying to do a more natural, holistic approach with my advisors. My spiritual advisors told me this was something that I should do more natural, so I'm going to try to get some other things done.
All right, well, absolutely. Okay, well, before we begin some new exercises, I want to know, how have you been keeping up the exercises that we practiced last time?
Well, of course, I've been doing some of those techniques over and over again. I'm doing the vocal hygiene. I'm trying to stop yelling so much.
Great.
My holistic approach of things is trying to help me calm down more. So,
Are you trying to get enough rest every night? And
yes, definitely trying to get a lot of rest. Definitely trying to calm down, not be so tense and stressed.
Good, good. Okay, and how about the yawn side technique that we practice? Are you still practicing that technique?
Yes, I practice that 3 times a day.
Great. Okay, awesome. Well, I do have a few more exercises that we can try today, and the first of them are going to be some warm-up exercises, okay, to just kind of relax the body. So the first thing I want to do is a breathing technique, okay? It's going to just help you to relax the muscles in your neck and your shoulders, okay? So what you're going to do is you're going to take deep breaths from your abdomen, okay, and your shoulders and your neck, all this should just be still. So just from the abdomen, okay? About 10 breaths. Good. You just feel your stomach moving in and out. Great. Do you feel relaxed?
Yes.
Okay, good. So now let's move on to the shoulder shrug. You're just going to shrug your shoulders all the way up to your ears and relax them. And when you shrug, you're going to inhale and exhale on the relax, okay? You really want to feel that stretch in your neck, okay? Great, and you can do that about 5 times too. And then we have a shoulder rotation warm-up that we can try. And it's really just rotating your shoulders in a circular motion forward. And when you move them forward, you're going to inhale and you're going to roll them backwards and exhale, okay? So let's just try that. Really try to roll them. Really get a good range of motion in the shoulders there. And really feel that stretch, okay? And you can do 5 forward and 5 backward. And you can do these warm-ups every day. You can do them when you wake up and just get your day started. And since I know that you're a world-famous singer, what exercises do you already know how to do for your voice?
Well, there is this one technique that is called the pitch increaser. Basically what you do is you start at a low pitch and you go to a high pitch, and we do this right before I get on the show, you know. So I'm just going to show you what I do. Is
Perfect,
that fine?
perfect,
Okay.
yeah.
I'm going to try to be a little quiet because I know we're in an office building, so okay. Woo! So something like a siren, and then you can start from low to high and
That is really great, and I'm so glad that you already know that technique because I was just about to show you something very similar. So we're going to do the same thing, but you're going to just add a puh.
okay.
Whoop-bah. You're just going to glide from low to high,
Okay.
and just add up at the end, okay?
Okay.
So let me see if you can do that.
Whoop. Woo. Whoop. Woo.
And this is really, you already know, this is really just warming your voice up and getting your vocal folds ready for the stress that you're going to place on them. Okay, thank you so much. Hello, my name is April Jones, and I will be seeing my client, Keonce Bowles, for her final follow-up visit to see how her vocal nodules have progressed. You may come in, Miss Bowles. Hello again. How are you?
Fine, how are you?
Good, I'm good. So I wanted to check on your progression and see how things are. Are you still having any concerns or?
No, the vocal nodules are completely gone.
Wonderful. That's great. That means that our voice therapy was successful because the purpose of voice therapy is, of course, to eliminate the nodules. We want to strengthen and balance your laryngeal musculature, and we want to also prevent recurrence. So I just want to make sure that you're keeping up with your vocal hygiene, because prevention requires healthy vocal habits on a daily basis. So, and you know that because your voice is your instrument, so you know that you have to protect it. So your vocal hygiene checklist, how's that going? Are you?
I'm still doing the hygiene, keeping up with things, trying not to yell. I don't smoke. Medications none of your business, but just the general.
All right. Okay, good. Okay. And we also did some exercises, the yawn side, and that was to expand your pharynx and relax your laryngeal muscles. Are you still using that?
Definitely still doing those.
Okay, because even though the nodules are gone, you should just try to keep these exercises up anyway.
Okay.
And the relaxation techniques that we did to relax some tension in your larynx and your vocal fold muscles, how are you still using those?
Definitely still using those. I'm actually implementing some of those techniques into right before performance, so I got that from you. Thank you.
Great. Okay. And of course the vocal warm-ups. I'm sure that you're using those also to prepare your voice for the stress that it's about to endure. Now, I'm just curious about the pitch glide also. Are you still?
Definitely still doing the pitch glide. I have vocal lessons 4 times a week, so therefore I need to do those every time.
Okay, great, because that really forces the use of all your laryngeal muscles, and it strengthens your vocal folds. That pitch glide exercise does. Okay, well, it seems like everything is going wonderful for you, and I'm so pleased that I had the opportunity to work with you.
All right, well, thank you so much. Would you like for me to sing you a song?
Oh my gosh, I would be honored.
Okay, pick a song.
Oh my gosh, any song?
How about some jazz?
Okay.
Okay. A tisket, a tasket, my brown and yellow basket. I send a letter to my mommy, and on the way I dropped it. Yes, on the way I dropped it. And if she doesn't bring it back, I think that I will die.
Oh my gosh, those nodules are gone.
Thank you.
That was amazing.
Thank you very much. That was free.
Oh, thank you. I see why you sell out all your concerts.
Yes.
Thank you so much, Ms. Bowles.
Okay.
It was a pleasure.
Thank
Question number 1. How did you feel about your therapy sessions?
I just felt it was great, a little bit of waste of time, but I'm happy to be here.
Okay. Are you ready for the second question?
Yes, ma'am.
Did you feel the therapy was helpful?
I did feel it was very helpful. Like I said, it took up a little bit of my time. I have a really booked schedule, but this is important, so this was helpful.
Okay. Did you feel your SLP was professional?
Definitely. I think that she was very professional. She did her job very well, so yes.
Do you think you can carry these techniques over in your daily life?
Absolutely. I already agree with you. I think she got them from me, actually. But, I'm very just grateful to have worked with her.
Last but not least, how would you rate your therapy on a scale of 1 to 10?
I would rate it probably at a 6.
Okay. Thank you for your participation.
Thank you.